This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. Coming up, the winter blues are real, and this year the pandemic is with us as well. We'll hear from the American Psychological Association about getting through the next few months. Also, healthcare has been a major campaign issue. Next week, the future of the Affordable Care Act will be before the U.S. Supreme Court. We'll get the latest from Kaiser Health News and find out what this case means for Americans who rely on the ACA's protections for pre-existing conditions. First, we reflect on the latest surrounding the presidential election. Joining us on Zoom is Kevin J. McMahon. He's professor of political science at Trinity College in Hartford. Kevin, welcome to the show.
Thank you. It's great to be here.
You can also join the conversation, 888-720-9677. That's 888-720-WNPR. You can find us on Facebook and Twitter at Where We Live. Kevin, you're a political scientist. Have you been refreshing your browser every few minutes to see what's the latest?
Definitely. I've been doing it as I was waiting to join the show.
All right. So tell us, what is the latest? I understand Biden is leading in Pennsylvania. There's a lot that we still don't know.
Yeah, no, he's pulled ahead in Pennsylvania. You probably know already that he took the lead in Georgia. We'll know more about Arizona and Nevada later in the day. That's the expectation, at least. In fact, one of the election news outlets, Decision Desk HQ, has recently called the race about a few moments ago.
And so how do you talk about this particular election, what's been happening since Tuesday with your students, Kevin?
Well, there's a number, one interesting aspect of the Trump candidacy is this idea of whether or not he was trying to mobilize voters or convert voters, right? So oftentimes, if you're just a new observer to the scene, you would wonder why President Trump was so aggressive in trying to speak to his base, right? That typically, if we think about what happens in the primaries tend to be about being more conservative. You're conservative message if you're a Republican, and a more liberal message if you're a Democrat. And then when the general election comes, you try to moderate that. President Trump didn't do that, right? And he hasn't done that. He didn't do that in 2016 either. And the question becomes why? And it's really based on this idea that instead of appealing to a swing voter, people we used to call NASCAR dads and soccer moms, that's not his strategy. His strategy is to turn out his people, right? To mobilize people who haven't voted in the past, and to come out and vote for him. And it seems like he did that, certainly did that successfully in 2016 in a state like Pennsylvania. And he seemingly has done that again this year in the state of Pennsylvania. However, two main differences from 2016. One is Joe Biden, right? Joe Biden was one of his arguments why he should be the Democratic nominee was that he would appeal to these white working class voters in places like Pennsylvania who didn't have a college degree that Trump did so well with in 2016, that Biden would appeal to them, and he seemingly has. And then secondly, that the third party vote, which while it was only 4% last time in the state of Pennsylvania, this year was just over 1%. So that 3% has seemingly made Biden won more of that, and that seemingly has made a difference.
We're still learning more about the people that voted this time around. I saw in the Washington Post just the other day that Trump so far has at least 4 million more votes than he did in 2016. So that speaks to what you were saying, Kevin, about getting his base to turn out and to appeal to new voters. But also when we think about the people he appealed to back in 2016, white working class Americans who may not have college degrees, I think the latest was there are a lot of white college educated men that voted for Trump this time around.
Yes, no, I mean, if you look at the breakdown of white voters, this is nationwide. Trump won every category. I mean, meaning, so breaking it down, college educated women and non-college educated women, and the same breakdown with men. He won every one of those categories. So, but what Biden did do was he was able to cut into the margins. Ultimately he'll probably win the popular vote by about 4 or 5%. So he certainly cut into the margins, and particularly in those, so-called blue wall states of Wisconsin, Michigan, Pennsylvania. Trump won each of those by a total of about 77,000 votes last time. And this year, Biden's seemingly going to win all three. And none of them comfortably, each probably only by 1 or 2%, but certainly better than Trump won them in 2016.
Again, you're hearing Kevin J. McMahon, professor of political science at Trinity College in Hartford, as we talk about the latest with this presidential election. When we think to polls, what happened there, Kevin?
Yeah, it's a good question. I mean, part of the answer is the fact that the way polls get reported is not clear, I should say. So, for example, if there's a poll that says, Joe Biden, a national poll that said Joe Biden up 48% to Donald Trump 45%, right, with a margin of error of 3%, that gets reported as Joe Biden has a 3-point lead, right? Mm-hmm. And in fact, what it means is that Joe Biden's number will range between anywhere from 45% to 51%, and Donald Trump's number would range from anywhere from 42% to 48%. So a poll that says Joe Biden up by 3% with a plus minus margin of error of 3 doesn't really say that he's ahead by that amount. It says that that's the range of what they're hearing in the polls, right? The other thing is, obviously some polls were particularly bad. The Washington Post had a poll of Biden up by 17 in Wisconsin. He'll probably only win that by about 1%. Mm-hmm. And Donald Trump certainly highlighted that poll as being out of whack. He did that last night. Washington Post also had a poll, though, in Florida where they had Trump up 2%, and he's ahead by about 3%. So that second poll was right on. And I do think just the number of polls, we look at that overall figure, and again, we just make a determination that was that's the right answer. That's the real number that Donald Trump is ahead or behind. And certainly the polls were wrong, and we'll have to, in some places, we'll have to look at that. But I think we'll probably find out that they were a little more right than we initially thought on election night.
Mm. You talked about the popular vote again in this election, and as we wait for results, there are many Americans who wonder why we are sticking with the Electoral College. And I just wanted you to maybe refresh our memories about why we have this system and maybe the arguments for and against it.
Yeah, I mean, the arguments for it are, we just think of the name of the country, right? The United States of America. That when the country is formed, it's a collection of states. It's not a nation in the same way that we think of it today. So the sense is that a candidate would have to appeal to all parts of the country, right? That you couldn't just focus your attention in the big cities, certainly more so today than at the time of the founding, but that you had to have this broad message. And the arguments against it are obviously that, the way you get those electoral votes is simply by combining the number of senators. Every state gets 2 senators, and the number of House members of the House. So a state like California, 40 million people, is going to be underrepresented proportionally than a state like Wyoming with about 500,000 people. So that's really, the votes in Wyoming are more powerful than votes in California.
We're hearing from people who would like to see the Electoral College abolished. What would be the process?
Well, it would take a constitutional amendment to abolish it fully, but there are other ways in which you might reform it. probably the best two examples are the state of Nebraska and Maine. As you know, in Maine, Maine and Nebraska have candidates win the congressional districts. So you can, for example, Donald Trump won Maine 2, right? The second congressional district in Maine. So he got that one electoral vote. Biden won the other congressional district, and he won the state. So he got the remaining Maine votes. The opposite happened in Nebraska. Biden won Nebraska 2. Trump won the rest of the state. So there might be a way to break up the state so it's not just one chunk, right? If we think back to 2000, the 2000 race, George W. Bush, after the Supreme Court decision, won Florida by 537 votes, but he got all of the state's electoral votes. So breaking it up might be an easier path to reforming the Electoral College as opposed to a constitutional amendment. Constitutional amendments are tricky to get for them to be a part of the Constitution, to be added to the Constitution.
And Kevin, what do we know about our electors in the Electoral College? How are they bound to the vote of each state when this is all said and done?
Well, like a lot of things, this is a state by state decision, right? That states, in fact, we don't just have one presidential election. We have 50 or 51 if you count the District of Columbia. So each state would have different ways in which they monitor these electors. But recent decisions have certainly allowed states to prevent, these so-called faithless electors, electors that would from a state like Connecticut would, instead of voting for Joe Biden, which he's obviously has easily won the state, would vote for, say, Donald Trump, or more likely a third party candidate.
We just have a few minutes left, Kevin, and I wanted to ask you about the rhetoric, the statements that President Trump has made since Election Day has passed, calling the process fraudulent, raising questions about the ballots that still need to be counted. And you're seeing in certain cities and areas of our country where people are believing that people have voted even after the election. I mean, how do you talk about this with your students and then the danger of this to our democracy?
Yeah, I mean, that's the phrase. I mean, this is dangerous to democracy. I mean, he's obviously very frustrated that he's going to end up losing this race. And at the beginning of election night, he thought he was having a very good night. The Republicans actually did quite well compared to our expectations. So he's upset, but he shouldn't be challenging the results of the election without even a bit of evidence, right? Even some Republicans, who have been quite shy during the Trump administration, have come out and challenged that. I saw Chris Christie last night saying that this is inflammation, right? He's inflammation without information, which was Christie's phrase, meaning that he doesn't have evidence to support these claims, right? He's just making these charges. This morning, Senator Pat Toomey, Republican from Pennsylvania, said the same thing about his state, the focus of this attention. So I think it's very harmful, potentially even dangerous for our democracy when you have this, these statements from the President of the United States.
We started our conversation talking about the fact that Joe Biden is leading in Pennsylvania. What will you be watching for today, Kevin?
Yeah, just to see, how much that lead turns out to be. Yesterday, I read that the Biden campaign expected that he would win by over 100,000 votes. Whether or not he can capture, Georgia, whether or not his leads in Nevada and Arizona continue to hold up, right? It may turn out, highly ironically, that he gets 306 electoral votes. That's what he's on the path to get. That happens to be the same number that Donald Trump won in 2016. And as you'll recall, he said that was a great victory to get 306 electoral votes. So it may be a repeat number.
But with the legal challenges that the Trump campaign has put forth, I mean, how long could this be dragged out?
My expectation is that unless they provide, solid evidence of some type of problematic vote counting, that those challenges, as we've seen already, the challenges have not been successful. The only challenge that was successful in Pennsylvania was that they were able to move their observers from 10 feet to 6 feet, right? 4 feet seemingly is not a great win, although the president said it was last night. There hasn't been anything to suggest that other than that these election workers are doing their working very hard to get the vote correct and trying to get it done as quickly as possible.
You're hearing Kevin McMahon again. He's a professor of political science at Trinity College in Hartford. Kevin, thanks for your time today.
Thank you. Happy to be here.
This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Coming up, we talk about the future of the Affordable Care Act. On Monday, the U.S. Supreme Court is expected to hear arguments about whether the health care law is constitutional. We hear from Kaiser Health News after the break, and we'll take your questions too. 888-720-9677, or find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. Next week, the U.S. Supreme Court will hear arguments that will determine the future of the Affordable Care Act. 20 million Americans rely on the ACA. For more on what's at stake, joining me now on Zoom is Mary Agnes Carey, senior correspondent at Kaiser Health News. Mary Agnes, welcome back to the show.
Thanks for having me.
I may have misspoken. I said Monday, but it is next week that the U.S. Supreme Court will hear these arguments.
Yeah, Tuesday, you got it.
So Tuesday. Thank you, Mary Agnes.
Sure.
For people who have questions about the Affordable Care Act and this lawsuit, you can join our conversation, 888-720-9677, or find us on Facebook and Twitter at Where We Live. So, Mary Agnes, refresh our memory, because it does feel like we've all been drinking from the fire hose. So much is going on, but this is an important lawsuit before the U.S. Supreme Court next week. Tell us about it.
Sure. What it gets down to is whether or not a provision called the individual mandate can be taken out of the law and the law can stand alone with it, or the whole law has to be taken down. And a quick background is in 2017, we might remember that Republicans passed a big tax cut. As part of that tax cut, they took away the penalty for the individual mandate. That was this requirement that most of us have health insurance or pay a fine. When that monetary penalty was removed, Republican attorneys general in Texas and other states that opposed the Affordable Care Act took a court challenge and said, wait a minute, if the penalty goes away, the law is no longer constitutional, because that's how the Supreme Court in 2012 made the law constitutional. So if the penalty's gone, the whole law has to go down. A judge in Texas agreed. That was appealed to the Fifth Circuit in New Orleans. They ruled 2-1 that yes, the individual mandate is now unconstitutional, but they sent it back to the lower court to say, does the entire law really have to go down? They wanted more reasoning, if you will, from the lower court in Texas. Democratic attorneys general from states that favor the Affordable Care Act, like California, said, wait a minute, we don't want the whole law to go down. We are filing suit to keep the law in place. They being the Democratic attorneys general, asked the Supreme Court, would you please rule before the election? The Supreme Court didn't do that, but they moved the arguments to November the 10th. So that's what we're going to hear next week.
So talk about how the court could rule that wouldn't disrupt the ACA or the protections for pre-existing conditions, Mary Agnes.
Sure. The court could say, yes, the financial penalty is gone for the Affordable Care Act, but the rest of the law can stand. It doesn't have to go away completely. But it could also say that the constitutionality of the Affordable Care Act was based on the ability of Congress to levy a fine against people who didn't enroll in the Affordable Care Act, pardon me, in that coverage. So The court could allow the law to stand without the penalty for the individual mandate, or they could say, you know what, that financial penalty assured its constitutionality. So if the penalty's gone, the whole law has to go down. And another ruling they could do is, if you look back at all the different filings, the Trump administration kind of late in the game and some of the judicial considerations said one option could be that the law is no longer constitutional in the states that filed suit, in those Republican states, which would be really complicated if they went that way. And they could also just dismiss the entire case. The Supreme Court could say the parties involved don't have standing, the legal arguments don't have merit, the whole thing just goes away and the ACA remains in place.
This time around, we have a new justice on the court, Justice Amy Coney Barrett. Will she be hearing this case?
That's the thought. I have not read or heard otherwise. She did not participate in a couple of cases that happened at the court right after she was sworn in. There were some voting cases with the presidential election, but the thought is that she will participate. She was asked a lot about the Affordable Care Act by Democrats during her confirmation hearings. And she said basically that she is not hostile to the ACA. She's not hostile to any statute that Congress passes, that President Trump didn't ask her about the ACA as part of the nomination process. So she's trying to be very clear there that she has no preconceived assumptions about the law.
We know during the confirmation hearings, there were senators that called that into question, including Connecticut Senator Richard Blumenthal. What do we know about her previous opinions that she's written or comments that she has made about the Affordable Care Act before she made it to the U.S. Supreme Court?
Sure. She made some judicial analysis of, we mentioned earlier, this ruling in 2014 by a 5-4 split on the court, including Chief Justice John Roberts, that said the individual mandate could stand because of Congress's ability to levy that fine. She wrote an academic paper criticizing his interpretation of the statute, said basically he went too far. But during her hearing, she cautioned senators to not confuse statutory reasoning, which is what she used in that analysis, versus a judicial decision making. And there's also two different things here at play. One is looking at whether or not Congress could tax, their ability to tax makes the law constitutional. That is one facet. There's also this issue of severability, right, which would be key in this decision, which would be a new argument before the court. Can the law stand without the penalty for people to get coverage? That financial penalty, as we know, is gone. Can the law still stand without it? That's a completely different argument before the court. And she urged senators not to confuse the two, that she has an open mind.
You're hearing Mary Agnes Carey here on Where We Live. She's senior correspondent at Kaiser Health News. As we talk about next Tuesday, the U.S. Supreme Court will hear arguments that will determine the future of the Affordable Care Act. If you have questions about this, we know it can be confusing. The number 888-720-9677, or find us on Facebook and Twitter at Where We Live. So Mary Agnes, let's get back to, if the court were to agree and say that this is unconstitutional without that mandate, what does that mean in terms of, as it gets kicked back to Congress that might try to replace it? And what do we know about President Trump's plan that he keeps saying that he has to replace the ACA?
Yeah, if Congress wanted to, for example, Congress could reinstate a dollar penalty for not having coverage under the Affordable Care Act. And there are many analysts that say if Congress simply reinstated a small penalty, this issue of constitutionality could go away. To your point, President Trump has talked extensively about bringing out a new plan to replace the Affordable Care Act, new coverage that will be better and cheaper. But as we know, we've heard that for a while and we haven't seen it. So part of the baseline concern here is if the Affordable Care Act went away completely, there'd be many, many ripple effects. For example, there are about 20 million people that have gotten coverage under the law's Medicaid expansion or on these things called the marketplaces, where people can get subsidies if they qualify for financial assistance and they can purchase coverage. But even if you don't fall into that category, millions of people are protected against an insurer discriminating against them for a pre-existing medical condition. As we know, adult children to age 26 can stay on their parents' health insurance. The idea of lifetime caps, lifetime limits and annual caps and so on have gone away. People on Medicare have benefited from lower drug prices. There are just sweeping impacts that would affect millions of Americans if the law went away, if it were completely thrown out.
We know that states have passed their own laws to protect insurers from denying coverage. Can you talk us through, what these programs would look like in states without the federal dollars to back it up, Mary Agnes?
Well, that's a great point because, as you note, states have passed laws to regulate the individual market. And if the Affordable Care Act were struck down, states could certainly at their legislatures pass laws that say no one could be discriminated against because of a pre-existing medical condition. But the Affordable Care Act has brought in so much money to states. For example, 8 out of 10 beneficiaries on those exchanges get some kind of cash assistance to purchase insurance. That would go away. The Affordable Care Act has given states money to help cover the increased number of people that have been eligible now for Medicaid because income levels were raised. That money would go away. And how could states, in an era where many states have lower tax revenues, they're fighting coronavirus outbreaks, where would they find the money to replace those federal dollars? That is a major concern.
And there'd be millions of people that wouldn't be able to afford or their coverage when you mentioned the expanded population under Medicaid, Mary Agnes.
Right, exactly. And that's the thing. Could states step up? And it would depend on what the ruling would be, right?
Yeah.
Chances are people would continue their federal subsidies for the planned year, which is often January to January under the Affordable Care Act. So maybe they would have a few months of coverage. But if the entire law were thrown out, if it were completely declared unconstitutional, and we don't know quite yet the makeup of the Senate. We know that Democrats are going to control the House, but the Senate is going to be fairly evenly divided, Democrats and Republicans. And Republicans in the Senate have shown no interest in trying to go in and make any changes to the Affordable Care Act. So that would be something, certainly to watch.
Mary Agnes, we mentioned the 20 million Americans who rely on the Affordable Care Act. I can't help but think that when we're in a pandemic, when we're dealing with the fact that people, if they get sick, they may need lengthy stays at the hospital and good care. This is really problematic to think that in a pandemic, these kinds of protections could be at risk.
Right, because another thing to think about right now is we are in the open enrollment season for the Affordable Care Act. That started November the 1st. So we've got people that may have lost insurance on their jobs, coverage, and so on. There are no official numbers, but some rough estimates we've had in our reporting is about 10 million people have lost coverage. Now, 2/3 of those folks have gotten it, perhaps their health insurance, again, through a new job, or maybe they're in the Medicaid program, or maybe they've signed up in the marketplace, right? And where there's still 3 million folks out there that don't have coverage. So it's not beyond reason to think they will be looking at the Affordable Care Act for enrollment. And again, to your point, with coronavirus, we have had real stresses on our healthcare systems, lots of people flooding the system. And if the infection rates, as we know, unfortunately, are continuing to climb. So we wouldn't want more people uninsured during that period. And to your point about coronavirus, that will now be a pre-existing condition for millions of Americans who they may have already had a pre-existing condition anyway, but if they've even had a mild case of the coronavirus, that could impact their future ability to get insurance if pre-existing conditions aren't protected.
This sounds like a big mess, Mary Agnes. I am glad
that's a good way to put it.
I'm glad that you mentioned the open enrollment that just started. I know that Access Health Connecticut, our state's ACA marketplace, is reminding people about open enrollment for coverage in 2021. I'm just wondering how this case affects the stability of the market and the insurers who participate.
Well, right now, for 2021, things are looking fairly good for insurer participation in the Affordable Care Act. Well, roughly speaking, you've got more insurers coming into the market. The price estimates, the prices of premiums rather, are not final, but based on estimates, it looks like any increases would be in the single digits, and many states may see decreases. So if we look back at the history of the Affordable Care Act, there's been a lot of uncertainty in the Trump administration over a variety of things that insurers built into their rates. Back in maybe 2018 or so, we had a spike in a lot of rates. But when the baseline for rates was raised, when insurers said, well, the federal government's no longer going to do these cost-sharing subsidies that are a different subsidy other than the premium subsidies and additional funding for lower income folks. When that went away, insurers kind of built that into their baselines. And so we've seen a relative era of stability for the Affordable Care Act. And of course, insurers months ago bid to participate in 2021, not knowing what may happen with the court case. But I think that insurers, beneficiaries, doctors, hospitals, all healthcare providers are so closely watching this case because they've changed their business practices based on the Affordable Care Act. Hospitals have had to make changes. Doctors have made changes. It's with getting more people covered and doing it in a different way, in the sense of the Affordable Care Act has something called the Essential Health Benefits Package, right? All plans under the ACA have to have things like pediatric care and maternity care and hospitalization. Some plans had that, some plans did not, right? But no preventive care at no out-of-pocket cost to you. That is a whole different mechanism for a provider and insurer. And if the law were thrown out, that would cause a lot of distress within the healthcare system itself, how care is administered. So it sort of would reach into every element of healthcare if the Affordable Care Act were struck down. And it's unclear whether that would be the case or not.
We got a Facebook question from Michelle who writes, assuming the Trump administration is successful in repealing this act, she wanted to know, how would it go away, Mary Agnes? Would it wind down in 90 days, or would the insurance companies be required to honor contracts currently in effect? And when would that end?
I think it would depend on what the Supreme Court said for a ruling. My guess would be what you just said. They would say, we'll honor the current contracts. And I don't know how they would navigate people who've signed up now to have coverage that would start January 1st. That could be fairly difficult. How much latitude would states have to enter in and try to mitigate any kind of effects of a ruling? But I think you'd have to look at what the court ruled and how much flexibility they gave. For example, you've got about 36 states who are part of the federal exchange. And then you have the remainder of states that have their own exchange, like Connecticut, for example. So how would that differ in the ruling, if at all? I think it's highly unclear.
Again, you're hearing Mary Agnes Carey, senior correspondent at Kaiser Health News. Mary Agnes, did we cover what we needed to know before Tuesday?
I think you did. You did a great job.
Well, we appreciate your perspective and your coverage as senior correspondent at Kaiser Health News. We'll tweet out links to her articles and her colleagues at Where We Live. Mary Agnes, thank you.
Thanks for having me.
This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Coming up, the winter blues are real. Pair that with the pandemic and having to isolate to keep us safe from COVID-19. And it's not wrong of you to wonder, what will the next few months feel like? We'll hear from Dr. Vail Wright, Senior Director for Healthcare Innovation at the American Psychological Association. And we'll take your calls and comments too. 888-720-9677 or find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Coming up Monday, how have Connecticut students and teachers adapted to the school year with hybrid schedules and online learning? On the next Where We Live, Connecticut Department of Education Commissioner Dr. Miguel Cardona joins us to answer our questions and yours. We hope you tune in Monday morning. Now, are you feeling stressed? It's after a major election, and we don't know yet who is the definitive winner. The holidays are coming up, and we're still in a pandemic. Joining us now with some good tips, Dr. Vail Wright is Senior Director for Healthcare Innovation at the American Psychological Association. Dr. Wright, welcome to our show.
Thanks. It's a pleasure to be here.
It has been a stressful week and it's not done yet. And so I wanted you to first maybe talk a little bit about this stress around the election and the constant waiting to see who is our president.
Yeah, in our annual Stress in America survey, we found out that 68% of adults reported that the 2020 presidential election was a significant source of stress, which was a pretty big increase from 2016, where only about 52% of adults reported stress. And, the stress is bipartisan. It was the majority of Democrats, Republicans, and those who said they're independent. So really, it's widespread, and I think it hasn't improved. As unlike normal years, we didn't have a victor when we generally do, and so I think that stress is just continuing for a lot of people.
So what are your suggestions for people who they want to pay attention because this is important for our country, but at the same time you don't want to be up all night and checking for updates on your phone?
Yeah, it is important for us to be informed, but the reality is we're going to know when we know. I mean, there's not going to be a secret about who wins this election, and so constantly checking your phone, refreshing your feed actually isn't going to make a result come any faster. It's not going to get you the result necessarily that you're looking for. So I think people need to take breaks from their devices. They need to be turning the TV off. They need to be doing other things that help soothe them, help build them back up. We are going to know when we know. And managing your stress in between by not constantly checking is probably a better way of going about it.
How do you know when all of this stress and anxiety is taking a toll on you physically? What are some symptoms people should be watching out for that maybe they could say, well, you know what, maybe I should turn that cell phone off or take a break or try to do something that is more productive than sitting in front of a screen?
Yeah, physical symptoms of stress and anxiety are actually really common and are typically the first things people feel. So that can look like anything from headaches to stomach problems, muscle tension, teeth grinding or sort of jaw tightening, sweating, increased heart rate. For me right now, it's a left eye twitch. Those are some of the physical symptoms, including difficulty sleeping and changes in your appetite.
When we think about this past year, specifically the past 6 to 7 months, it's been a lot on all of us, Dr. Wright. And so you add the impact of the pandemic on what's happening in our country and world, and the fact that we're not going to be out of this anytime soon. And so how should people be thinking about the next few months, especially with the holidays coming up?
Yeah, we found in our survey that 60% of adults said that it's the cumulative effect of all these stressors all at once that are really feeling overwhelming. And part of that is because of the level of uncertainty in our country right now. And uncertainty makes it really hard for us to plan, and it makes it hard for us to figure out what's in our control. So that's really what our advice is to take active steps to identify what is it that's in your control. What sorts of steps can you make to modify your behaviors, to really focus on how you're feeling and how you're thinking, to help reduce your stress and manage better. And some of those things in particular require just some really foundational aspects. That's eating healthy, staying active, getting enough sleep, and staying socially connected. And obviously right now, a lot of that might look virtual or look a little different, but we know that those 4 things, when combined with a routine, really set the stage for being able to manage stress better.
You're hearing Dr. Val Wright here on Where We Live. She's Senior Director for Healthcare Innovation at the American Psychological Association as we talk about the moment that we're all in a pandemic. We're waiting on results of a major election. Winter is approaching. It's common, Dr. Wright, for many of us to kind of get the winter blues with the cold weather. But now we're in a pandemic. We have to stay away from people sometimes that we would maybe normally see on a daily or weekly basis, and that can be really challenging to think about.
Yeah, we know from research that about 5% of the population get the winter blues, or what's sort of clinically called seasonal affective disorder. I think one of the things we're concerned about this year is that with the pandemic, being able to be outside, I think, has felt like a safe haven, a respite for a lot of people. We know that the disease is less, you're safer outside in terms of catching the coronavirus. And as it starts to get darker and as it starts to get colder, I think people are not going to feel that they can use the outside as much as possible. So our advice is really about planning ahead. How can you maximize your sunlight? how can you maximize your time outside? How can you think about creative and different ways to stay connected socially, even if it's not that socially distanced walk you were doing around the neighborhood like you had been this summer?
We have a question for Dr. Wright. You can join us 888-720-9677. That's 888-720-WNPR. Find us on Facebook and Twitter at Where We Live. We had our governor just say yesterday, Dr. Wright, that because cases are rising here in Connecticut, that gatherings should be under 10, and that Thanksgiving may look very different from years past. That's a tough pill to swallow for people who look forward to the holidays, to seeing family and friends, and realizing that may not be possible this year.
Yeah, I do think it's important that people have appropriate expectations and the right mindset going into the holidays this year. It is going to look different because of the pandemic. But if we can approach it not as something being taken away from us, but as an opportunity to try new things, to start new traditions, I think that really opens up possibilities for people to think about, what could I do this year that I haven't done in the past? So that can look like, using video platforms to stay connected, maybe not for the entire event of, say, Thanksgiving, but that part where you all say gratitude right before the meal starts. Or maybe it looks like doing a new recipe that you never felt you could do because you knew somebody in your family wouldn't have approved of it. So I think, again, it's about looking at opportunities and reminding ourselves that while we don't know exactly what the future is going to look like, it's not going to be like this forever. So modeling how we can handle holidays differently, especially for our families and our children, become an incredible teaching moment for how we can be resilient as people, as families, and as a nation.
Resiliency is important, but if you have someone in your family or someone that you're close with that is experiencing anxiety, how can we help them?
Well, the first thing is just to be there for them. I think a lot of what kind of gets in our way of really approaching people about their emotional health is this fear that we have to fix it for them. And that's not often what people are looking for. People are really looking for someone to listen to them, to validate how they're feeling, to ensure that they're not alone. And then to possibly problem solve, what can we do differently to manage our stress or anxiety? And that, again, can just look like simple coping skills or staying connected in a more active way. And at the other extreme, it can look like seeking out some professional help.
We've been talking about mental health over the last few months here on our show. You've mentioned the survey that the American Psychological Association has done. If we take a step back and we look at mental health in America, what are some points that you want to raise about making sure that we are helping people in our communities and getting them the right resources when needed?
Yeah, I think what this current situation with the pandemic and with the other stressors has really laid bare is the disparities that we see in this country. And in particular, that we haven't necessarily taken a public health approach to managing our mental health in the same way that we've taken a public health approach to managing our physical health. And the challenge, of course, is that the two go hand in hand, and you really can't talk about one without talking about the other. And so our hope at APA is certainly a broader dialogue around how can we not just provide professional services, and right now, obviously, that means telehealth, right? So seeing a therapist either via video conferencing or on the phone only, but also how can we talk more about prevention? How can we have workplaces and schools that provide the kind of emotional support that we need in order to weather such national level stressors like what we're seeing right now?
At the start of the segment, I reminded our listeners we're going to have our state education commissioner on Monday, and we're going to talk about how online learning is going. But when we think about talking with educators and officials in our schools about how we can do a better job providing support not only to students and parents, I'm just curious what kind of conversations that you've been part of as we are dealing with this phenomenon around our country of children, being in front of screens more often, not having that engagement like they used to.
Yeah, so it gets pretty complicated, right? Because it's not just the exposure to the screens, but it's how you're using them. So, using screens to connect with family members, using it as a platform for education is really different than using screens for, say, video games or some sort of more passive kind of approach. So we encourage people to not be so worried about the screen time, but really how the screens are being used. And so we've been having conversations with organizations like the Parent-Teacher Association about, again, how can we be supportive for our children? And one of the biggest things we can do is talk to them, to ask them how they're doing, to ask them if they understand what's going on, and then just talk with them in developmentally appropriate ways about what we know, what we don't know, and why it's so critical to engage in self-care right now, and how can we model that for our kids. And one of the ways we do that, of course, is by putting down our own devices when we want to spend family quality time together.
And what about for parents, Dr. Wright?
So again, the message is similar. Kids pick up on our anxieties. So it is really important that parents model sort of calm self-care behavior, because your kids will pick up on that. And if you can, this is a really a unique teaching moment, if you want to think about it that way. It's certainly an unprecedented time. And if you can, again, model for kids how to manage the stress, that's step one. I also think we need to be relying on our family members. We can't do everything ourselves. If you're fortunate enough to have a partner, have a spouse, tag team this approach right now, so that, when you feel that you're getting run down, that you've got somebody else that you can rely on, and then come back into the fold. We've got to be taking care of ourselves, because if we don't take care of ourselves, then we can't be the most effective parents, coworkers, spouses, partners that we can be.
I like that tag team with your spouse on the days there when one or the other is feeling a little more spent. We just have a few, about 30 seconds left, Dr. Wright. And so just as we end, again, focusing on what we can look forward to in these next few months, that'll help us.
Yeah, I think it will. I think that since the beginning of the pandemic, we had to hard pivot to work from home, e-learn, figure out how to get groceries, and we've kind of got that routine down. And now it's really about, how do I get unstuck? How do I create a life worth living, where I have something to look forward to, where I can actually, get some meaning out of this time right now, instead of feeling like everything is being taken away from me. So I really encourage people to think actively about, what do I want my life to look like right now, even though I can't control everything outside of it.
Dr. Vail Wright, again, is Senior Director for Healthcare Innovation at the American Psychological Association. Thank you so much for your time.
Thanks for having me.
This is Where We Live on Connecticut Public Radio. Today's show produced by Tess Terrible. Our technical producer is Kat Pastor. Again, Connecticut Department of Education Commissioner Dr. Miguel Cardona comes on the show Monday to answer our questions and yours. If you're a parent or an educator, we definitely want to hear from you Monday morning. I'm Lucy Nalpathanchel. As always, thanks for living. Thank you for listening, and we hope you have a great weekend.